Welcome back. Allergy season is starting earlier than usual, and for many, it's already showing up in our eyes.
Yeah, if you're dealing with itching, redness, or eye watering, you're not alone. This morning, we're talking to Dr. James Dello Russo, an optometrist who's sharing tips to ease eye allergy symptoms and help find you and us some relief. Doctor, good morning. Thank you for being here. We appreciate it. I feel like it was 2 weeks ago that it was 25 degrees out and so dry, and that was irritating my eyes. Now we have the spring allergens to not look forward to, I suppose. So why is it that this time of year our eyes are really susceptible to redness and irritation?
Well, I noticed on my drive over here, there's buds on the trees, and, especially in April and May, we see a skyrocketing amount of pollen from grass, trees, and flowers, and that's what really makes our eyes uncomfortable with all those allergy symptoms that we go through.
What are some common symptoms of eye allergies?
Well, usually people associate allergies with a lot of eye itching and redness, tearing and swelling, and kind of that gritty, dry irritation. Yeah.
So in terms of treatment, if you're recommending to a patient that is really challenged with their eyes watering, redness, it's bothering them in the day-to-day, do you recommend that they take something like Claritin for allergies, or is it eye drops specifically for your eyes?
Well, it can be, kind of a multifaceted approach. A lot of people do start with, like what you said. They'll do a Xyzal, a Claritin, and Allegra because it helps with a lot of those nasal issues, but it also can give you a little relief from a lot of those itching and redness and irritation that you go through. But sometimes the best choice is that topical antihistamine, where you get that inflammatory blockage right on the surface from drops like Pataday or Zaditor or Elasticaf. They've been around for a while, and they're safe and effective ways to manage allergies, so you can actually do both.
Yeah, and with recent recalls in recent years,
yes,
eye drops, how do you know, especially if you're allergy prone, how do you know you're getting the right kind for you? And is there any way to avoid picking up a product that, could be recalled?
Yeah, it's a good question. When you go down that eye aisle in CVS, there's a myriad of different choices, and it's kind of a dizzying thing to look at. But typically what we really want to look at is you can of course start with just preservative-free artificial tears, because they are great from mild allergies. We can flush a lot of those allergens off the ocular surface, especially if you're a contact lens wearer. You're kind of getting a lot of that allergen that's sort of, adhered to the ocular surface out of the eye. It helps with dryness and itching. And then, of course, you can use topical antihistamines such as, Pataday or Elasticaf or Zaditor. They really do a nice job of blocking itching. I usually would probably say Visine you can do every once in a while, but it's not a great thing to do on a daily basis.
So that's what I was going to ask, because I'm not 100% sure. You say preservative-free eye drops. That's not the majority of the Visine that you see on the you have to specifically look for that. Most eye drops have the preservatives in them?
Yes. So Visine has been around for a while, and it can be helpful for redness relief, but a lot of the active ingredients, tetrahydrazine, similar to epinephrine, it makes the blood vessels blanch, the eye looks white, and it seems like the problem is over. But you get this rebound effect. When it wears off in an hour or two, your eyes are just as red as when you started. So sometimes a preservative-free artificial tear is a better choice, or using Pataday, which again is an antihistamine, and that really kind of blocks what drives the itch, the histamine.
For your patients that are sensitive to the weather, do you recommend they stay inside when pollen starts to come out?
Well, it always is a good approach is avoidance. So if you spend a lot of time outdoors, I always recommend a good, set of wraparound sunglasses to act as sort of a barrier to keep wind and pollen out of the eyes. Closing the windows in your cars if you're driving, or closing the windows at bedtime just to keep the pollen count out of the house. And also, if you spend time outside, make sure that you take a shower and change your clothes, because you will retain pollen on your body.
Dr. Dello Russo, I really appreciate you being here. We've learned a lot in a short period of time, and I think people at home will now know what is safe and what's potentially something you want to use sporadically and every once in a while. So thank you very much.
Thank you.
We'll be back at 8 o'clock with more of today's top stories in just a couple minutes. Stay with us.